Hello everyone and welcome to QuickMed, where medicine is explained quickly and easily. In this video, we will be discussing febrile seizure, including how it presents, what it's caused by, and how we treat this. So let's get to it. Febrile seizure is the most common neurologic disorder of infants and young children. It typically presents between the ages of 6 months to 5 years. And keep in mind that this is not considered a form of epilepsy, which is when you have recurrent non-febrile seizures. There is genetic susceptibility, as those with a family history are more likely to experience febrile seizures, although the exact mode of inheritance is not yet known. So what is the definition of a febrile seizure? Well, as the name applies, you'll have to have a true fever, which we define as a temperature of at least 38 degrees Celsius or 100.4 degrees Fahrenheit. And the second part to this definition is that there has to be no other seizure-provoking etiology like infection or inflammation of the central nervous system. So this can include things like meningitis or encephalitis. And with the second part here, there also has to be no previous history of afebrile seizures. The fever here typically occurs in the setting of a viral or bacterial infection, but it is not the infection itself that is the cause of the seizure, it is the fever itself. In contrast, complex febrile seizures are focal, prolonged, and can occur in more than one episode within the first 24 hours. So let's discuss how to evaluate patients that present with a possible febrile seizure. The main question you want to answer here is whether the seizure occurred from a febrile seizure or from a more serious etiology like a central nervous system infection. So this would involve a general physical and neurologic exam, including examining the vital signs for any fever or tachypnea and tachycardia. We also look at level of consciousness in terms of how alert the patient is, and we also look for the presence or absence of meningeal signs, and this includes headache, neck stiffness, and photophobia, which is also known as light sensitivity. And then during the physical, you really want to look for any focal deficits, like any differences in muscle tone or muscle strength, because this will really point you in the direction of another underlying cause for the seizure. And unless you're really suspecting another cause for the seizure, you really don't need to obtain any lab work or lumbar puncture or any neuroimaging. Now, when it comes to treatment, the majority of febrile seizures will have resolved by the time the patient is being evaluated. And so typically we don't need to treat febrile seizures, but of course this is patient dependent. So for instance, if the seizure is prolonged, then we can use benzodiazepines. Okay, so now we've discussed the cause of febrile seizures, how they typically present, and whether or not we need to treat them, but there are two major things to keep in mind here. These are key things to keep in mind, not necessarily just for examination purposes, but also when counseling parents, because oftentimes parents are going to be very concerned about their child. Parents might ask you, is this likely to occur? And the answer here is yes. Children with febrile seizures are at risk of developing recurrent febrile seizures with future illnesses during early childhood. The overall risk here is approximately 30 to 35%. Another question parents might ask you is, did anything happen to my child as a result of the seizure? And the answer here is no. Virtually no neurologic deficits occur as a result of a febrile seizure. Alright, now that we've gone over the material, let's go through a practice question as usual to solidify your understanding. Here we have a 3-year-old girl who presents to the emergency room following a witnessed seizure. The patient has had 3 days of clear rhinorrhea, non-productive cough, and sore throat. However, 1 hour ago, she suddenly lost consciousness, fell to the ground, and began shaking her arms and legs. The episode lasted 5 minutes. Although the patient had some temporary confusion afterward, she has since returned to her neurological baseline. The patient has no other significant medical history. Her temperature is 101 degrees Fahrenheit, blood pressure is 100/55, pulse is 98, and respirations are 20. On examination, the patient is alert, fully oriented, and not in any distress. The remainder of her physical and neurological exam is unremarkable. Which of the following is the most appropriate next step in management? So let's look at some of the key pieces of information here. Here we have a patient who had 3 days of clear rhinorrhea, non-productive cough, and sore throat, so sounds more like a viral infection here. And then her seizure involved the shaking of her arms and legs, so this is a generalized seizure, and it lasted about 5 minutes. Given this and the fact that it was one witness seizure, this meets the criteria for a simple febrile seizure. And we can call this a febrile seizure because her temperature is elevated. It is 101 degrees Fahrenheit. And then we have no abnormalities that are noted on examination, and she is alert and fully oriented. So given that she's had a fever and a viral infection and really no other possible causes for this seizure except for a febrile seizure, she does meet the criteria for a febrile seizure. So the answer here would be D, supportive measures only. Ceftriaxone and vancomycin here are used for treatment of bacterial meningitis, and so this is incorrect. Dexamethasone is sometimes used along with ceftriaxone and vancomycin for treatment of meningitis, and so this is also incorrect. Ethosuximide is actually a treatment for a different type of seizure known as absence seizures, and so this is incorrect. And valproic acid here is also used as an anti-seizure medication in certain instances. Alright everyone, we hope you found this video helpful. If you did, please make sure to like and subscribe so that we can keep posting videos like these, and as always, good luck studying everyone.